My name is Kathleen Kennedy. I went to Union Mine High School. I was a meth addict and alcohol abuser, and I used pretty much anything I could find for 3 years. I've been clean for 3.5.
So tell me, when did you start using amphetamines?
When I was 15.
You were 15, so you were in high school.
Yeah.
How many people do you think at the school at that time were using crystal meth?
About 5 or 6 that I knew of.
That you knew of, that were your personal friends?
Yeah.
Okay. So have you noticed any effects on your teeth since you've been using crystal meth?
Yeah, they break easier. So.
Why are you here today?
Because I got broken teeth.
Why don't you show me what you came in holding today? I notice you keep putting your hand over there. Why don't you show me here how you walked into the office today?
It's my heat pack.
Why are you using that heat pack?
Because my wisdom tooth is broken.
Uh-huh. And how do you think that happened?
From using meth.
You think so?
Yeah.
All right, Kathleen, these are your x-rays, and what we're going to see up here is, this is tooth number 1, and it's pretty badly decayed, and that's the wisdom tooth we're going to take out. And here's tooth number 2, and that's also pretty badly decayed, and that's probably going to need a root canal, more than likely. If you look over on the other side, we don't have a full set of x-rays here, but if you look over, now here's a root canal that was done.
Yeah.
And it's pretty unusual to have to do a root canal on such a young girl, and you would think that somebody would ask a question as to why you're having all these problems. And here's tooth number 16, which is also very badly decayed. It's taken a lot of years for it to get that bad. We're going to take that out too. And then if you look down on the bottom here, which is another important thing, you have a large cavity between tooth number 18, your second molar, and tooth number 19. Okay, and then if you look over on the right side, tooth number 30 also has a large cavity. That's your lower right first molar. And you can see you had a really large cavity on tooth number 31, which now has a filling. And there's 32, which is going to go bye-bye soon. So you can see that you have some problems just on these 4 x-rays. We don't have the whole set right now, but just on these 4 x-rays, there's a lot of problems that need to be addressed. So we're going to get you back in the room and take care of 4 of those problems right now, okay? All right, now, what you're going to see here is this is the first molar, here's the second molar, here's the third molar. The third molar is really gone. It's really not much left of it. The second molar, you can see what crystal meth helped do, which is basically it ate away all of the outside part of the tooth near the gum line. Okay? You see that? Mm-hmm.
She wonders why the birds fly by and don't stop in for tea. She wonders why the ghost on the side of her bed shakes his head at me. You know she lives the best she can, but she knows she dies a little more every day. I hate the games she plays like your mother-in-law, but I just can't help but play them. She comes to me and cries. I tell her real lies. You can't find love if love was never there. You can't find love if love was never there. She wants to be a superhero for everyone to see. She wants to do something amazing for everyone but me. You know she lives every day, but she dies a little more every night. I hate the game she plays like your mother-in-law, but I just can't help but fight them. She comes to me and cries. I tell her real lies. You can't find love if love was never there. You can't find love if love was never there.
One of the biggest challenges facing El Dorado County and many other counties like ours is the widespread use and abundance of crystal meth and crank. Hi, my name is Jamie Goodis. I graduated Ponderosa High School in 1998 and now attend George Washington University School of Medicine. I have been working in my dad's dental clinic and have gotten to see firsthand the ravages that crystal meth has wrought upon the bodies as well as the teeth of many of my peers. This is a very sad and frustrating thing. There's got to be something we can do about it. So many of these patients have come into the dental clinic that we began filming them. All of them are devastated that as a consequence of their drug use, they will lose the majority of their teeth before the age of 30. They all want you to know one thing. It's not worth it. It's not worth it to lose your teeth, and it's not worth it to have dentures by the age of 28. And most of all, it's just not worth it to do the drugs. It hurts me to see so many of my previous classmates in here having their teeth pulled out because of drug use. So if you don't get anything else from this, get this. It's not worth it. Don't do drugs.
Hi, my name's Justin, and well, this is what happens when you use crystal meth.
Where'd you go to high school?
You need mine.
How's it going? I'm a former meth user for 7 years.
Where did you go to high school?
I went to El Dorado High School in Independence.
Did you graduate?
No, I haven't yet. I'm currently an adult ed.
What grade did you start using drugs?
7th grade.
7th grade?
Yeah.
What high school did you go to?
I went to Union Mine and I went to Juvenile Hall High School.
My teeth, I have really bad teeth from using crystal meth and methamphetamines for the last 16 years. I'm 32 years old now. I can't go out in public and smile and feel confident about my smile.
Where'd you go to high school?
I went to high school at El Dorado High, Ponderosa, Independence. The drug it's no good for you. It lowers your self-esteem. It lowers your capabilities of what you can and what you think you can't do. You can't do everything you want. But to not have good teeth and to use and not have good teeth, it just really hurts to go out and to get a job. It's hard to get a job. To feel at a public function and to smile and to be around in-laws. You never know who you're going to meet as you grow up.
Why aren't we showing your face on this?
I don't know.
Because
the reason why I don't want my face shown is because it's really hard to, once you are labeled as a user and people can see your teeth, they know you're a user. And I don't want my face to be shown because I've changed my life. I've quit and I've been clean for a year and a half now, and I'm here at the dentist's office trying to get my teeth fixed because I have low self-esteem. I can't smile. All those things. I'm here to get my teeth fixed for something.
Well, let's take a look here. I just want to show some. Let's see what's going on here now. Look over here, and this is what you see on your typical crystal meth user. You see large carious lesions on the outside surfaces of the teeth, especially down by the gum line here. Okay, turn this way and toward me a little bit more. Come on over this way. And here it is on the other side too. So when we see this smile, what we see is a large expanse of lack of tooth structure here. And you can see it starting on the teeth in the back too. And when you smile, how does that impress somebody who you're applying for a job with?
It doesn't. I don't even really have to smile. They can see my teeth and they automatically label me as a user. And it's really hard, especially when you decide to quit, and hopefully you guys will never start. But if you do, hopefully you decide to quit before it's too late.
Hi, my name is Jennifer Silva. I am currently in Union Mine High School.
Hi, I'm Kat Kennedy. I dropped out of Union Mine High School.
Hi, I'm Vince Boss. I work full-time.
Where'd you go to high school?
I went to high school at Charter Community School.
And before you were there, where'd you go?
I went to El Dorado High School, but I got kicked out being dad.
I'm Sharon Stone. I just have tooth pulled. I went to Union Mine until I got kicked out.
Okay. And what do you think was one of the main reasons that you three, not you, you're not in trouble for anything, so you keep it that way. What do you think was the main reason that you folks got kicked out of school?
Drugs.
Drugs, yeah.
Drugs.
Drugs and drinking.
Fighting.
Drinking at a young age, that probably wasn't a good idea.
What drugs were you using?
Well, everything I could get my hands on when I was younger, pretty much.
Were you able to buy them in school?
Oh, yeah.
Where did you do them when you were in school?
I usually didn't do them at school. I usually ditched school to do them, which really got me in that got me in the most trouble. It's not going to school, so.
I just did it behind the library.
In the counselor's office.
Yeah,
I was too scared to do all that.
same spot at Union Mine, so.
A lot of people say that, there's not drugs in school, but they're not aware that there is. There was problems for my mom when she was in high school, drug problems for me in high school. There's problems for the kids now in high school. It's all out there and it's horrible. There's too much.
I think kids start drugs for boredom, attention, to fit in, all that, and that's just not right. I started because of depression, and I didn't have anyone to talk to, so maybe if you talk to your kids, they'll stop too.
A survey in the El Dorado County School District shows that 1% of 9th graders and 1% of 11th graders have used methamphetamine within the last 30 days.
If you count Ponderosa, El Dorado, Oak Ridge, and Union Mine, that comes out to about 75 kids.
Like that.
Don't think that these kids are doing it by themselves. They're sharing and they're telling their friends that this is the drug to be taking, and that's wrong.
It's really sad to think that some of these people are trying to influence my friends and even me to do drugs, and that makes me really sad.
I'm Shannon Stone. I went to Union Mine High School, and I started using methamphetamines as a freshman. I believe I was 14 years old. I'm now 20, almost 21. I've been clean for about 4 years now, and the immediate, or how would I put that, although you don't think drugs might not affect you, it might not do it immediately to your body on the outside, but it immediately affected my teeth. I might not have taken the best care of them, but that did not help it at all. It made it a lot worse. I really don't know.
Why are you here today?
I'm here because of how bad my teeth are. I've had a lot of pain. The two days now, my face has gotten swollen. I've had to go to the emergency room for 3 times this month alone because of one tooth that's just falling apart. All my teeth pretty much are falling apart on me. They have no more structure. All the enamel's disappearing on them. And it's really hard because you need those to eat every day, It's really painful, and I don't like waking up in the middle of the night dealing with all this pain. And it all, again, goes back to the drugs that I experimented with.
Well, guess what?
What?
We're going to take your tooth out.
That's good. Now get it out. Because it hurts.
All right, let's get going. Let me look at your x-ray for just a minute, okay? And we'll talk about this.
Okay.
Okay, so if you look over here, Shannon, okay, you'll see that the big problem you have on this tooth is you have an abscess resulting from really deep cavities, and started a root canal some time ago. Since then, it's been swelling up and swelling up and swelling up, and now it's been a while, and this tooth's pretty hollowed out, so we're going to take that one out for you.
Okay.
Okay, and you can see there's not a whole lot left of the internal structure of the tooth. It's pretty much nothing more than a shell anymore. Okay, but I want to point out something else on your x-rays. You see down the bottom you've already lost the bicuspid, and of course our goal is that we don't want you to lose any more teeth if we can avoid that. Okay, and what you can't see on the x-rays here is that you have several teeth that have areas with cervical decay, which is something that's almost pathognomonic or very commonly seen in people that were using amphetamines. So we're going to take a look inside your mouth in a little bit and try and fix one tooth, and we're also going to take that other one out for you today. And what you can see here is on the second molar, she's got cervical decay, which is really attacking the tooth. And if we look down toward the bottom, open up just a little bit and turn toward me. That's it. She's got cavities on her lower first molar and on the biting surface and the facial surface of her lower second molar. Cavities on the upper left side got so bad that she ended up needing a root canal, and that's the tooth that is in pretty bad shape today. We're going to be pulling that out later. But additionally, we have cavities down here on the lower left side on her first and second molar, and on the upper, this is the tooth we're going to be taking out later. This is that root canal that's not doing so well. I want this to be the last
Sister Kate Harrington. I graduated from El Dorado High School in 1999. I'm going to be going to Loma Linda Dental School in a couple weeks, which will be September 2003. And I've been in the dental field for the last 4 years, and I've seen a lot of dental decay as a result of crystal meth and various other drugs. It's important to brush and floss your teeth daily and avoid any kind of drugs that will damage your teeth. Otherwise, they will end up like these teeth in this jar. Very beautiful.
Which drugs did you use?
Methamphetamines, crystal, crank. I just found out I have 17 cavities and 2 root canals.
How do you feel about that?
It's kind of crappy, actually.
No one ever told me it would ruin my teeth. So no one ever told me that I'd be 5 foot tall, 85 pounds at 19 years old either. I just figured it was something you do. My friends' parents were doing it and so were my friends, so I did.
But it's on campus.
Oh, it's definitely on campus. That's where I actually started. The first time I ever did meth was I did a line in the Union Mine bathroom with a girlfriend. So.
What do you do at the Union Mine bathroom?
Bathroom? Go to the bathroom and wash my hands.
And that's what you should be doing up there.
Hi, I'm Dr. Goodis, and been watching a lot of things on film today, and I'll just tell you, it really makes me feel bad. When I have to take out a lot of teeth on people. I have a couple of kids of my own, you know, and have a lot of young girls that work for me here, and it's really frustrating. We try to help them all. Sometimes there's just nothing we can do, and we lose a lot of teeth. So don't get involved with drugs. Stay away from them. Stay away from crystal meth. Stay away from everything that you can stay away from. Have a good time. Enjoy your life. But don't end up in my dental chair if you can avoid it.
I mean, I wish I would have known the overall outcome when I first started, or I would have never known.
Okay, let me show you some of the things on your x-rays that you'll be able to see, okay?
All right.
Come on over this way. Okay, if you take a look over here, you'll see that this tooth has a huge cavity in it, so it's obviously been neglected for a long time, and this is one of the ones that's going to need a root canal. And then we'll come over to the other side, and you see there's cavities between your front teeth up here, and once again there's a large caries restoration there, and this is going to need a root canal, and this tooth is also probably going to need a root canal, so you may need up to 3 root canals. How old are you now?
I'm 22.
So in 22 short years, most of these teeth have only been in your mouth since you've been about age 13. We've managed to do a lot of destruction there.
Yeah.
So if you had to say anything to the kids up at Union Mine and El Dorado and Ponderosa, what would you say to them?
I'd say the best thing you do is not ever do this drug, ever.
Hi, my name is Dr. Tan, and just wanted to let you know that the last patient we just saw is one of the many patients we see that use crystal meth, and you can see the destruction that it can do to our teeth. So make sure you just watch out what's going on here so that we can avoid.
Don't let it be you.
Don't let it be you.
And one of the major impacts that it's had is on my teeth. I've lost almost all of my bottom teeth and back, and I'm about to lose some more, and I've had a lot of root canals. I'm about to have 4 more. That is so not worth what it does to your body and what it does to your dentals. I mean, it just has no. There's no words that I can say that would emphasize enough what it does to you and what it does to your body. Methamphetamine kills and destroys your teeth, your bones. It destroys everything.
Hi, Erica.
Hi.
So what brings you here to the dentist today?
Abscess tooth.
How did that happen?
Partying.
Really?
Mm-hmm.
How old are you now?
30.
When did you start partying?
14.
What was your drug of choice?
Meth.
You started at age 14.
Mm-hmm.
What made you take your first hit?
Peer pressure.
Peer pressure. Now, how many teeth do you think are in trouble in your mouth right now?
More than half of them, probably.
More than half of them. Let's go look at some of the x-rays. Come on over with me, okay? Okay, so you can see up here, if you look very closely, your upper first bicuspid is pretty much broken off and had a root canal done. So that means you've been to a couple of dentists. And this is your upper left side, Erica, and you can see, once again, your upper left first bicuspid here is pretty broken off, and your second bicuspid, and here's what's left of your first molar right here. It's pretty much gone. This is your second molar. And you can see that those teeth have pretty much gone down to the roots, and if you look closely over here, you can also see what's left of your third molar. Just a couple of root tips, they pretty much decayed down. But the real reason you're in here today, if you look very closely, the real reason you're in here today is because this lower third molar has pretty much been eaten away, and it's decayed pretty much out. There's not a whole lot left of it, is there? No. Well, let's look over at the other side. If you look down here at the lower right side, you can see that your first molar and your third molar are both in dire straits, and they both need to be extracted. And your second molar.
What's the second one? Yeah.
Well, from here, it looks like it just has a little cavity on the back.
Okay.
We'll probably be able to hold on to that.
Really?
Okay. Yeah.
Good.
So it's nice we're going to have something that you can
Eat with?
have a basis for chewing. Yeah. When you were in high school, okay, did you think your behavior changed once you started using it? What happened to your behavior?
I didn't want to be at school.
You
I
didn't?
didn't care.
How did your grades change?
They just went down.
They went down? What made you start taking amphetamines in the first place?
Just friends I was hanging out with.
How long would you stay up for at one time?
3 weeks once.
Sometimes you stayed up for 3 weeks,
Just
solid.
once, yeah.
And after that, would you crash for a while? How long would you be
3
sleeping?
weeks.
So your memory's okay now, but you have.
But there's things, yeah, that I forget.
Okay. Did you ever get to the point where you were seeing shadows and things that weren't actually there?
Tree people.
All right. Can you tell me about that? Tell me what you would see.
Yeah, just illusion, just illusional, just lack of sleep.
So tell me about one of the illusions. What would you see?
Things move that weren't really moving.
What would be moving?
Trees.
The tree would move?
Trees, cars. You can show the world my mouth?
Yeah. Not the whole world, just anybody willing to watch it.
All right.
Okay?
Well, if it helps.
Is that all right with you?
If it helps, yes.
It will. We're trying to save kids from going through this because they need to know what they're in for.
This is what, 15 years of?
It's horrible.
How many years did you use methamphetamine for?
Seriously? 15?
15?
About 15.
What made you stop? Or did you stop?
I mean, yeah, I party once in a while, but...
So you still use it?
Once in a while.
On occasion. How much is methamphetamine costing now?
25 bucks, a quarter gram. Methamphetamine is a hard drug to quit. People just can't quit on their own. Once you get too into it, it's an everyday, daily thing.
And we can see back here looking up a couple molars, okay, but here's the tooth she had a root canal on, and now what's left is a tiny little stump. Come around to the other side. Here's the first bicuspid, and second bicuspid's pretty gone. And the first molar, you can see it leaning up against the second molar, just a little piece of the root left. The third molar is pretty much gone behind there. And if we look down the bottom, we can see that our lower third molar is pretty much broken off. On the other side, we can see the lower first molar is pretty much down to fragments of roots, and the same with the lower third molar. We're down to little pieces of roots, and that's all that's left of it. Very hard to visualize down there. So you really managed in 30 short years to impact some really good destruction on your mouth. And we're going to get out a couple of those teeth for you, okay?
Thank you.
So what are we up to, Erica?
Removing teeth.
We're going to lose some teeth.
Yeah.
And mostly because of?
Drugs.
And you used them for how many years?
15.
Okay, there's our first molar. Oh, there's some tooth. Yeah. Yeah, that's left of it. And here's the bicuspid. And this had a root canal done. You okay? Good. You sure?
Since the time they won't turn back for you.
We'll try to get the root canal one that don't want it.
The water slowly wash away. And we both know this time can't pass much slower.
There we go. And there's the bicuspid.
And my eyes will roll past your block out what's never said on my tongue. There's a mutiny, yes, my tongue. Well, it's got something to say. Well, thanks for all the time you never spent with me. I hope you know it's made me who I've come to be. I'll always remember the times that we've never seemed to have. But in the end we both know this boy, he's getting older. Clock will tick and talk, but the sense of time they won't turn back for you. The clouds will slowly float away, and we both know they can't hold back much longer. Yeah, my eyes will roll past your absence. My ears can block out what's never said, but my tongue, there's a mutiny, yes, my tongue, it's got something to say. Well, thanks for all the time you never spent with me. I hope you know it's made me who I've come to be. I'll always remember the times we never seemed to have, but in the end we both know this boy, he's getting older. Thanks for all the time.
Voy a poner estas gasas en el área donde fueron las extracciones. No, open. Open. Don't bite. Okay, now bite. Okay, good.
Okay.
Hi, my name is Stephanie Hui Hui. I started doing methamphetamine when I was 15 years old. I'm here to have 3 teeth extracted. I have absolutely no chewing teeth left in the back because of using crystal meth. I have 4 children, and it's something that they never ever ever want to do. I've taught them this is what you don't want to do. I live in Placerville, and I just want to get my teeth, what's left of them, fixed. Don't do drugs. Just don't.
You're not even 40 years old.
No, I'm 39 years old.
And you're going to lose just about the rest of your back teeth. How do you feel about that?
It makes me very sad. It makes me extremely sad. I was very proud of my teeth, and using crank has completely ruined my mouth and my health. So that's how I feel about it.
This is your upper right first molar, okay? And you can see the back half of it out here is all missing. That's right over here. That's missing. And then over on this one, this is your upper left first molar, I think. You already lost your bicuspid, right? And the one in front of that has a big cavity in it too. And that's going to probably need a root canal or to be extracted. And you can see that's got a big hole in it underneath this filling. There's the hole right there.
Hi, I'm Dr. Goodis again, and I just want to let you know, a lot of these people that we've seen on this film are from some of the local high schools. And I don't want you to picture this as these 2 high schools are the only 2 high schools in the whole United States having a problem. I think this is a problem that I would call epidemic. What you're seeing here is a snapshot. If I had my office in San Francisco, all the kids would be from 2 high schools that are in the area surrounding my office. So when you look at this, I just want you to realize this is a problem that just doesn't reach to Ponderosa and Union Mine and El Dorado High School and Ponderosa High School. It's everywhere, and it's something that we as parents and we as doctors have to realize and think about. So I want you to watch this movie and think, okay, hey, maybe I shouldn't do these drugs. Maybe these things are bad for me. And if this movie keeps one kid, just one kid, from going on these drugs, then we'll have accomplished our purpose. So, once again, don't do drugs. They're not good for you. They don't help you. And where do you end up? You end up here. You end up with holes in your teeth. You end up with cavities. You end up with a lot of problems. Okay? Don't let this be you. Don't be the next patient in my chair having teeth pulled out because for 4 years in high school or 4 years after high school, you decide to do crystal meth. And have a nice day. Don't forget to brush and floss. And remember, this is a production of Mitch TV. Have a good day. Bye.